welcome everyone to this another interview with a very intelligent young chap called Ryan Khan. The goal of this little podcast today was just to talk a little bit more about drug policy, but more within the scope of students and universities. So Ryan is a very, what should we say, passionate advocate of the science around drugs and has undertaken a lot of work over his research years to advocate more for the science of drugs, how it can be integrated into the university policies that we have, and how we can maybe reframe or review drug use at universities and make it safer for everyone involved. So without further ado, Ryan, would you mind introducing yourself to those who haven't heard of you yet, Ryan, and just a couple of the things that you're doing, where you are at the moment, where in the world people can find you, and yeah, just a little bit more about yourself, Ryan.
Yeah, wicked. Well, first, just to say massive thanks for having me on. This is the first time I've done something like this, but it's a real pleasure. So yeah, I'm Ryan Khan. I'm a third year student at the University of Leeds. I study human physiology. I did a year in industry last year working for Cancer Research UK. And I've worked with a couple of different organizations over my time as a student that exist in the kind of drug policy, drug research sphere, such as like drug science, now mainly with SSDP, a little bit with transformed drugs as well. And I guess just my kind of where I come to this point in the conversation is I was really surprised at the lack of information and infrastructure around drug taking at university, to be perfectly frank. It was something that really shocked me, acknowledging that students are one of the highest using demographics of drug takers, and that at a lot of universities to this day, there's still a complete zero tolerance policy which offers no relevant harm reduction information, and that unfortunately leads to disproportionate harm to drug takers, in this case specifically students, whether that is poor mental health from maybe misinformed drug taking decisions, or overdose related deaths. And I think it's just something that's important to consider is that, I believe, and very much the evidence around me shows, that we live in a very much a drug taking society. And by that, I don't mean I endorse or advocate anyone to necessarily take drugs, but a reality is that many people do. And many people start doing that when they're a student, when they come to university, and they may have not had, much education, much exposure in their adolescence before. So that puts them at quite a degree of risk. And I'm a strong believer that we kind of have a duty to be educating young people on these topics. And unfortunately, at the University of Leeds, I really didn't feel like I was seeing enough of that. So that kind of motivated me to do the work that I've been kind of progressing on over the past couple of years. And it's kind of aligned to my studies. I have a bit of a background in kind of human physiology. My course kind of encompasses pharmacology and neuroscience, but I guess my wider interest came from, my personal experiences, seeing how my friends were getting on, and just observing kind of university and student culture.
It's something that I definitely don't remember encountering at all when we were sort of entering university. It was literally, just that sort of just say no, or well, we don't talk about that sort of question. And obviously the first thing that happens to all of the students when they get to university is all the drug dealers give out all these little cards and numbers, and it's pretty much rampant. And I don't know how it is in Leeds, but I know a lot of the metropolitan universities have a bit of reputation now for the drug use that does go on, and there's a whole night scene based around some of those drug taking experiences as well, which is quite strange as well. But it all seems to be taking place under the surface, and like I say, not something that's really being brought out into the conversation for students or for the staff. So I guess how's that impacting students, and what have you seen? I guess maybe the negative impacts of some of the approach that we have at the moment, what are we doing wrong, would you say?
So just like it's important to acknowledge that as time has gone on, and over the past 20 years, we've seen a rampant increase in the use of drugs. You look at like cocaine consumption, that's increased by 34%. Opioid use has gone up by 50%. Cannabis, 31%. And that's probably the exact same with ecstasy and other stimulants. So from my experience and all of the literature I read, is that a lot of cities in the UK now, and student metropolitans, universities, sorry, are also, mass drug culture is extremely prevalent. It's everywhere, and it's very, very normalized. And this is partly due to the accessibility of drugs that we have nowadays, with, as you mentioned, dealers distributing cards, using social media to boost their engagement, and also, prices falling as well. We're seeing prices for some substances like MDMA, cocaine, being cheaper than they've ever been before. So collectively, this leads to a massive increase in accessibility. And that, combined with the freedom and I guess the lack of parental control that students can enjoy, means that use is to be frank, is prolific, of a multitude of different substances. And the reason where this gets harmful is because people don't necessarily know, one, what they're taking, two, how to take it safely. Things like, dangerous combinations, relevant doses. People will build up this knowledge over time through personal use or, conversations with friends, maybe reading online platforms. But this information isn't readily available. And that means that for a certain degree of people, you can get a large degree of harm happening to them along the way. Whether, as I mentioned, that's overdoses, very harmful interactions between concomitant use of substances, or deteriorating mental health because of excessive use. So these are the kind of issues that can be affecting students. But frankly, with a lot of the illicit substances, it's not in the conversation from the university's point of view. Alcohol and tobacco, which of course are very important drugs to acknowledge as well, which have a significant degree of harm. And there might be some promotion of harm reduction messages from the universities on those fronts. But generally, with the illicit substances, in a lot of universities, not all of them, but it's a zero tolerance policy. So that means that, any student caught with their own drugs or dealing drugs is, one, probably going to be expelled from the university. And that in itself creates a stigma within the student community, where they're not wanting to go to the university for support, if they need it, if they're struggling with drug-related issues. And for me, that's a massive shortcoming from these institutions, because frankly, that is an issue that a lot of young people will be facing. And the lack of openness from the universities, the lack of it having a frank conversation, and the stigma and potential punitive effects that someone will have if they are associated with drug use, I personally think is terrible, because it isolates people who are potentially already struggling with substance use issues or with mental health problems to come and openly get support.
I guess in a way, universities are semi-facilitating this drug use as well, because obviously they're getting lots of young people coming to their dormitories. There's lots of potentially alcohol naive students as well, who've just got this new wave of student loan money. You've got all of these peer pressures, all of these societal nudges in different directions as well. And it almost seems as though the burden of safety and supervision should be on the university that's facilitating that experience as well. So it is quite strange that sort of hands-off, don't get involved approach is taken. And I guess it's semi-bordering on a sort of negligence in a way, from a very sort of, to throw some different perspectives around there. But you mentioned also how that could potentially lead to criminality as well. And if someone is, say, implicated in some of these, there's maybe not just the drug taking experience, but then that possession as well, and the potential repercussions of that. If you're on campus, maybe less likely to have a criminal interaction, I suppose, or there won't be too much police involvement. Maybe it'll be kept more as campus security. But for those that are outside of the university compound and outside of the university grounds as well, you're right, there's nothing there to sort of educate or inform or provide some sort of like safety net to all of these. I guess, again, young people, end of the day, they want to make independent decisions, but there's not a lot of empowerment there from our centers of learning that are meant to be facilitating the next generation of adult. Why is this such a controversial topic? And it seems quite common sense when you lay it out in terms of, well, providing people with, like, we do it with driving, don't we? We provide driving lessons, help people understand how to move the cars. And like you say, it's not there for alcohol either.
So I think one of the reasons that a lot of universities, we're not kind of getting the sufficient engagement that we need to see on this topic, it's because concerns that by even kind of engaging in this conversation and say delivering something like a harm reduction message, you may in some way be seen to be advocating or justifying drug use, which is not necessarily the case. As I said earlier, it's understanding that people are going to make these decisions independently, but by giving them the information to make more informed decisions, you can therefore directly reduce the harm to themselves and their prospects in the future. So, you know, that's a conversation that is important for me to be important. It's important to be having with, you know, these academic institutions, also with parents, and, you know, even on a peer-to-peer basis as well, because the harm reduction is one of the main focuses on the work that I do and the society that I'm part of, which is Students for Sensible Drug Policy. That is one of the main types of work that we do.
At the moment, then, on the note of that work, Ryan, like, what does a sort of peer-to-peer education process look like? Because lots of students, all different schedules. How do you, sort of facilitate that? Do you catch people sort of at clubs before they go in, or is this sort of like a on-campus sort of event? Like, could you maybe...
So I'll just give a bit of background about like SSDP. So that stands for Students for Sensible Drug Policy. So it's this international organization which kind of sits in the harm reduction and drug policy reform sphere. And they've got different chapters of university societies across the country. So the one in Leeds was started, I think, the year before COVID. I took it over as president this academic year, and it's a very relatively small society. We've got 3 people on the committee, but as I mentioned, our aim is to engage students and create an open platform to have discussions about, you know, drugs and provide non-judgmental kind of advice. And, you know, although that we acknowledge, yes, drug use is illegal, but we also understand that young people use a disproportionate amount of drugs, especially when they join student communities. And as I said, we want to reduce the harm that they expose themselves to. So some of the work that we've done over the year has been kind of like, we did a campaign in Freshers Week promoting some really simple harm messages about, you know, starting doses of different drugs, as I mentioned, different combinations, certain signs that you should be aware of if you see like happening in your peers, that when you should be seeking medical attention. We constantly kind of post infographics and harm reduction information. For example, drug circulations that have been identified that are extremely potent or may have adulterants. That information will go up on our social media platforms. And then we also do educational events kind of once every 2-3 weeks, where we get in guest speakers and talk about different topics. So we've had the Loop come in and talk about the importance of drug testing. We had research come from Imperial talking about psychedelics in psychiatry. Tomorrow, we've actually got a speaker from Transform coming to talk about stimulant use and policy reform. So we have a lot of different events which are ultimately aimed for people to, you know, come and join this discussion, for them to educate themselves, and then for them to, you know, join us in conversation if they want to afterwards, if there's something that they want to talk about, or they're concerned, or they need some resources or information. We are essentially trying to fill that void of information that I frankly feel the university should be contributing to, but just doesn't happen, unfortunately, to the extent that it needs to.
How, if you are a student, can you get involved in the SSDP, and yeah, where can people find and interact with the organization? And to add on to that, Ryan, as well, is it the same at other universities as it is at Leeds, or how does that vary?
So what I would recommend doing if you want to get involved with SSDP is see if there's a society at your university. There's multiple of them across the UK. If there's not an SSDP society, I'd look for a drug science society or the psychedelic society. They kind of exist in similar kind of spheres. And alternatively, if not, you could look at setting up a society yourself. There are blueprints and support kind of packages on the relevant websites for drug science and SSDP about how, you know, you and your peers can collectively get together and make this happen. And empowering, you know, trying to empower young people to do that, because it's, as I said, this is in a conversation that isn't happening as frequently as it should do. And yeah, then there's kind of stuff you can get involved with on a wider national, international level through SSDP as well. But yeah, grassroots is really, really important.
So from a university perspective and from your perspective as well as a student, what could the universities be doing? What could other students be doing to sort of improve the situation at the moment? Are there any measures people could take in the short term? Or what are we maybe missing at the moment?
Yep. So a real emphasis that we have at SSDP at the moment is the importance of testing kits. So we have a discount code that students can use to buy these from a verified source online that's completely legal in the UK. We encourage people to use these to test the drugs that they're going to use. And yeah, that maybe takes a little bit more preoperative planning, or, you know, you're being a bit more conservative, but ultimately you're protecting yourself and your friends by doing that. And the importance of that is higher than ever, because at the moment we're seeing more and more adulterated drugs on the market. For example, with MDMA being with having synthetic cathetones, or being more PMA, which is, you know, considerably more dangerous. Or we're also seeing drugs that are super high potency. Again, with MDMA, for example, I think there was some pills identified in Manchester in November last year that were about four times the dose. I think they're about 470 milligrams, which is 3 to 4 times the dose that an adult should be taking of MDMA. So testing is really important to identify that the drugs you're taking are pure to an extent, because realistically they're not really that pure that much on the market these days. Well, a lot of them, MDMA at the moment specifically, but also giving information to people about dosing. Because, you know, if someone goes and takes that 477 milligram pill of ecstasy, there's a very, very high chance they're going to collapse and their temperature is going to soar, and then they're going to go into a coma and maybe die. If people know what a safe dose of MDMA is, that can convert a pill into a very dangerous object in something that's frankly quite benign. So it's little pieces of information that are really, really important, and also providing the infrastructure for students to make these more informed decisions. So that's something that we've been pushing forward, is trying to get the University of Leeds to provide free or subsidized drug testing kits. There are universities around the UK that do this. For example, Bristol provides free kits. I know Sheffield has provided subsidized kits. So it is being done, but there's it's a difficult thing to push through with the universities, because there's, you know, with that example, there's problems with kind of liability. So it's a complex topic, and I understand the complexities of it, but it can be done, and it should be done, because it's needed now more than ever.
Perhaps we should mention here, Ryan, some of how you've come about to have such a grounded understanding of drugs and health, and perhaps a bit more discussion around your degree and dissertation topic as well might be an interesting area to sort of help people understand as well. Because I think ayahuasca, the sort of king of the psychoactive concoctions, really sort of demonstrates, I guess, some of the hidden benefits as well of some of these drugs beyond the recreational potential as well. And as you're sort of in the depths of your dissertation at the moment, Ryan, I thought it might be a good time to spring the question on you, and yeah, for people to get a bit of an understanding of ayahuasca as a potential therapeutic as well.
Yeah, that's a really great point for raising. So a lot of my kind of interest as well is in the medical and therapeutic uses of some of the drugs that some of them we've mentioned today and some that we haven't. So at the moment, I've been focusing a lot on psychedelics, for example, psilocybin, which is the psychoactive ingredient in magic mushrooms, and ayahuasca, which is a brew, which is a concoction of different plants that's used in the Amazonian rainforest by different indigenous communities, which contains DMT and some other chemicals. And I've been looking at those and kind of their effectiveness at treating different mental health conditions. So whether that is depression, anxiety, anorexia even, there's a huge amount of research going on in this sphere, and it's absolutely amazing some of the results that we're seeing for patients who've been suffering very debilitating illnesses such as depression and haven't had relief from the conventional treatments, which is about 30% of people who suffer from major depressive disorder don't get relief from conventional pharmaceuticals, which is SSRIs or monoamine oxidase inhibitors. And we need to be finding innovative solutions, and the data that's coming out on psychedelics that's being conducted in this country at institutions like Imperial, King's College, or abroad in the Netherlands or in the United States, say Johns Hopkins, is bringing out some really, really promising results. So this is a really, really interesting research field at the moment, and it's massively burgeoning. And yeah, I guess I'm kind of at this point where I'm thinking, where would I like to go into this space with my career? Is it more the academia side? Is it the therapy side? Is it the more commercial side? And yeah, still working that out. But I'm really passionate about this because I've seen the data, and I know people who have had experiences that have had profound positive impacts on their mental well-being and therefore their whole livelihood. And for me, that's so important that people have access to these medicines in the right context, in a controlled and safe environment. But I think that's a right that when the data shows it, people, as it is doing, people should eventually have.
It's interesting how a lot of these drugs are being culturally and historically part of society, but only in the last sort of 80 years have they been prohibited and banned, and now we're sort of rediscovering them. And a lot of these are naturally occurring compounds as well. And so it's almost like we've had the blinkers on and decided that, oh, this side we're gonna focus on, and that side we're going to demonize and never look at and sort of turn a blind eye to. So it's really, first of all, incredibly important that you are researching an area like this, Ryan, but also that there are more people our age getting into this field too, because it is sort of so it's counterintuitive. It's not even counterintuitive, is it? It's more counterculture almost, or counter. Yeah. What the term would be there, Ryan?
No, I guess it's kind of tackling cultural baggage. So that is a big issue with psychedelics, for example, and that's why we're not really seeing so much research into LSD at the moment, because the depth of the cultural baggage that holds as a drug. But I imagine we will in time. But a whole part to this conversation, which what we at Students' Sensible Drug Policy is trying to embody, is having a frank, non-judgmental discussion about, yes, the harms of drugs, but also in certain cases, the benefits of them as well. And that is an equally important part to this work is public opinion. And public opinion's been positively shifting in the right direction. There were some polls that came out, YouGov polls last year, that were looking at public opinions on the medical use of psilocybin, for example, and they were actually very positive. So we are seeing a shift, but this work is equally important as the research, because a lot of these drugs, they're still Schedule 2 substances, which means that Schedule 1 substances. So what a Schedule 1 substance is that it's different to class A, B, and C. That's more related to the kind of punitive effects that is associated with supply or use of these drugs. But the scheduling is essentially an assessment of the medical uses and potential, and also the potential for abuse and harm of the drugs. So, for example, psilocybin, which is currently a Schedule 1 drug, as was cannabis until 2018, deems these compounds as having no medical value. And when a drug's in Schedule 1, it's very, very hard to conduct research on it because of the bureaucratic kind of barriers, because of the financial costs. It's a lot harder to do research. And now we're seeing increasing calls from, politicians, from activists, from scientists, to reschedule these drugs into a Schedule 2 substance, which is now what cannabis is, which means that it can be prescribed by specialist physicians in certain contexts, and therefore it is available as a medicine. Unfortunately, and it's also a lot easier to research. Unfortunately, with cannabis, we're still seeing very, very few actual prescriptions, even though it technically is available. And again, part of tackling that problem is consulting with patients, it's consulting with the public, it's speaking to your mum and your mum's mates about this topic, because ultimately those demographics of people might have more conservative opinions, probably because they grew up in a time where there was a lot of prohibition towards drugs, and a lot of misinformation, and frankly not evidence-based policy.
You mentioned there your family. How do your family and sort of student friends as well interpret a lot of this? Because I imagine, well, for me as well, I have to have that sort of conversation. Like, you have to almost sell it to your family so that they understand it, and so that they understand it as well. Because otherwise, it just sort of washes over them. And so, like, how's that process been, and what are maybe tips that you might have for people in having that conversation, like opening up that conversation, I suppose, notwithstanding them going and doing a degree about it as well. So that's it's a gradual conversation. I'll tell you that for a start. But it is something that you can build a relationship with your parents, even if they have very, very strong opposing views to all drugs, for example. And I guess the way that I would highlight, maybe first going into that conversation, is there's two ways you go about it. One is the medical research that's shown, and the evidence supporting, for example, drugs like cannabis, psilocybin, or even MDMA. Like MDMA in the United States is being used therapeutically to treat PTSD. It's about to get licensed by the FDA, and it's also been very effective for marriage counseling as well. So look up those kind of things and present that information to your parents. But also another kind of point that's come to the conversation, which is, I guess, a little bit darker, but it's acknowledging that drug-related deaths are higher than they have ever been. I think in the past 9 years, between 2011 and 2020, there was a 72% increase in drug deaths in the UK. So for me, that is a public health disaster that is extremely destructive to people's lives and the families around them. So one of the ways that we can reduce that death and that harm is by developing harm reduction policies and giving that information to people. Is well documented in the literature that this works. You look at Portugal, which, for example, decriminalized, this is, I guess, a little kind of a bit further extreme, but decriminalized drugs for small amounts of possession and adopted a more medical-based model towards people who were, and health-based model towards people who were using drugs, and instead of locking them away in our prisons, which not only does that massively detrimental to that individual when they come out of prison, it puts them at a lot higher risk of maybe even using a substance in prison due to the culture there, the boredom. And there's so many ways that you actually can come to this conversation. But if it's something that you're thinking about, reach out, join a society like this,
start opening your mind up, having conversations with people, educate yourself, read. There's some amazing books out there, amazing resources on the internet. I'd really recommend looking at the Drug Science website or reading some of David Nutt's books, like Drugs Without the Hot Air is a great place to start. Listening to podcasts as well. Drug Science have got a fantastic podcast. So educate yourself on this stuff, and then talk to people about it. And I think what's important as well is, as I said, some people are going to have very stark opposing views. But what I would recommend is just trying to find a middle ground with something that you can both agree on. Whether that's how ludicrous it is, locking someone up for multiple years when they were caught with cannabis when they were 18, which has cost something like £44,000 a year of the taxpayers' money, or whether that's actually how, when we provide access to supervised injection facilities, that massively decreases the overdose deaths associated with like heroin use, for example. So learn about an aspect that's important to you, and then go out there and talk to people and start discussions.
Thank you so much, Ryan, for guiding us through some of that. I was going to ask if you had any, bit of a freestyle thinking session as well, Ryan. Like, are there any topics that I've maybe not seen that would be worth mentioning, ones that maybe current events that are coming up, or potentially things to keep an eye out for people that are coming up over the next couple of weeks?
Yes, so a good event that's coming up is a student conference that Drug Science are putting on. I believe it's the 9th and 10th of April, double check, I might be wrong, but that will be, that's got an emphasis on psychedelics and the research and therapy space that's going on there. But that will be a really great networking opportunity for young people. There's a really cool event on the 24th of April, which is called Action for Change. That's going to be in London, which is hosted by, you've got the likes of Neil Wood speaking, Ryan Zafar, who's from Imperial, some really great speakers, and that's going to be a wicked day. I'm going to be attending both of those events. And yeah, just like, as I said, get on the social media, follow SSDP, see if there's a local branch, or find a Drug Science Society. And there's a lot of stuff on the internet that you can access, and I'd be more than happy to create a little resource list for people, if that's something that we could include in the description, because it's important that people know where to go to find this information, and that in itself is a problem, as we discussed, because the information is there, but a lot of people don't know where to go for it.
What we'll do is, I think, try and consolidate as much as we can in the description of this video, and hopefully we can direct some people towards this, and then they can pick out any links that they find sort of relevant for them. But yeah, I wanted to say thank you, Ryan, for talking us through some of this. And there's not many people you can talk to about drugs and at universities and the sort of student experience all in one. So I think we've done a good job there of covering everything and surmising the sort of taboo.
Thanks for having me to talk. And yeah, all I guess that I want to do is to work with other students, to work with the academic institutions, to help make things better, and to protect people, but especially young people, because I don't want harm to happen to people. I know they're going to make their own decisions, and they should have a right to do that, but to do it in an informed and educated way.
Well, thank you so much, Ryan. We'll continue the conversation, the messaging and education as we go. But yeah, really appreciate your time today, and we'll do another one short. I am so appreciate it, Ryan, and thank you so much, and speak with you very soon.
All right. I'd just like to say thank you as well to my other committee members as well, which is Rob, Harriet and Pius, SSDP leads. Shout out to them as well for all the work we do together. Thank you.